I'm about to show you something that surprises almost everyone the first time they experience it. Something you've had your entire life, something you're using right now that can lower your blood pressure in under 2 minutes. No medications, no supplements, just your breath. In this video, I'm going to guide you through 3 simple breathing techniques, step by step, counting every second, so you can feel the shift in your body as it happens. These techniques work fast because breathing directly controls your nervous system. When breathing is fast and shallow, your body shifts into stress mode. Blood vessels tighten, pressure rises. But when breathing becomes slow and controlled, your body receives a very different message. Blood vessels relax, heart rate slows, blood pressure begins to fall almost immediately. This isn't theory. Research consistently shows that slow, intentional breathing can lower systolic blood pressure by 10 to 20 points in just minutes. That's similar to the effect of adding another blood pressure medication, except this has no side effects, costs nothing, and works anywhere. Sitting in a chair, lying in bed, even standing in line. By the end of this video, you won't just understand these techniques. You'll have practiced them. You'll know exactly when to use each one, and you'll have a tool you can rely on anytime your pressure spikes from stress, anxiety, or poor sleep. Let's start with the first technique. The first breathing method focuses on lengthening your exhale. This is one of the fastest ways to signal safety to your nervous system. The key is that the exhale is longer than the inhale. That longer exhale activates your body's natural calming response, telling your blood vessels to relax and your heart to slow down. Here's how it works. You breathe in gently through your nose for a slow count of 4. Then you pause briefly, holding the breath for a count of 7. Finally, you exhale slowly through your mouth for a count of 8. That extended exhale is where the real magic happens. It shifts your body out of stress mode and into relaxation mode. Many people notice changes almost immediately. Heart rate settles, shoulders drop, the tight feeling in the chest eases. Some people see noticeable drops in blood pressure within just a couple of minutes. Now let's do it together. Sit comfortably with your back supported. Relax your shoulders. Place one hand on your belly so you can feel it move. When you breathe in, your belly should gently rise. When you breathe out, it should fall. If you have a blood pressure monitor nearby, you can check your pressure now and remember the number. We'll come back to it shortly. First, empty your lungs completely by breathing out through your mouth. Then close your mouth and slowly breathe in through your nose for 4 seconds. Hold that breath gently. Then slowly breathe out through your mouth, letting the air leave your body completely and smoothly. Repeat this cycle several times at your own pace. There's no strain, no forcing, just smooth, steady breathing. Each round tells your nervous system that you are safe, calm, and in control. After just a few cycles, many people feel a noticeable sense of calm. If you checked your blood pressure before, check it again now. Even a small drop matters, 5 points, 10 points. Those changes add up when practiced consistently. This technique works best when used regularly. Try it a few times a day, in the morning, during the day when stress creeps in, and at night before bed. Just 2 minutes at a time can train your nervous system to stay calmer throughout the day, not just during the exercise. And this is only the first technique. Stay with me, because the next breathing method works even faster during sudden spikes in blood pressure, and it's one you can use discreetly anywhere, even in public. The second technique is called resonant breathing, and it's even simpler than the first. There's no breath holding at all. You breathe in for 5 seconds and breathe out for 5 seconds, creating a slow, steady rhythm of 6 breaths per minute. This breathing rate is considered ideal for calming the nervous system and lowering blood pressure quickly and safely. This technique works because it creates something called cardiovascular resonance. Your breathing, heart rate, and blood pressure begin to synchronize. As that synchronization happens, stress hormones drop, blood vessels relax, and the heart begins to beat more efficiently. Blood pressure follows and starts to come down. One woman in her 70s struggled with anxiety-related blood pressure spikes every time she entered a medical office. At home, her numbers were fine, but the moment she sat in a waiting room, her pressure would surge. She learned this breathing technique and practiced it quietly for 5 minutes before appointments. The result was dramatic. Her readings dropped into a calm, normal range before she was even called in. That's the beauty of this method. You can do it anywhere. Sitting in your car, watching television, lying in bed. No one around you will even know you're doing it. Let's practice it together now. Sit comfortably and place a hand on your belly. Breathe in gently through your nose for a slow count of 5, then breathe out through your nose for a slow count of 5. Keep the breath smooth and relaxed. There's no forcing and no strain, just steady, natural breathing at a slower pace than usual. Continue this rhythm for several cycles. Inhale calmly, exhale slowly. With each breath, your body receives the signal that it's safe to relax. Many people feel a noticeable sense of calm within the first minute. For the best results, practice this breathing for 5 to 10 minutes, once or twice a day. Morning and evening work especially well. Over time, this technique doesn't just lower pressure in the moment, it helps keep your baseline blood pressure lower throughout the day by training your nervous system to stay balanced. Now let's move to the third technique. The third breathing method is the most powerful when blood pressure spikes suddenly. This is the technique you use during moments of panic, intense stress, or nighttime pressure surges when you need fast relief. It's called alternate nostril breathing, and it's been used for centuries to rapidly calm the nervous system. Modern studies show it can lower blood pressure faster than many other breathing techniques because it forces slow, controlled breathing while balancing stress signals in the brain. Here's how it works. You'll use your right hand. Gently close your right nostril with your thumb and breathe in through your left nostril for 4 seconds. Then close your left nostril with your ring finger. Release your thumb and breathe out through your right nostril for 4 seconds. Next, breathe in through the right nostril, close it, open the left, and breathe out through the left nostril. That completes one full cycle. This alternating pattern immediately slows breathing, steadies heart rhythm, and reduces stress hormones. Many people experience noticeable relief within just a few minutes. Let's practice together. Sit upright, but relaxed. Bring your right hand to your face, use your thumb to close the right nostril and gently breathe in through the left, then switch and breathe out through the right. Continue this pattern slowly and smoothly without rushing. After several cycles, pause and notice how your body feels. Heart rate steadier, breathing deeper, a sense of control returning. This technique is especially helpful at night, when anxiety can make blood pressure climb even higher. This is your emergency tool. When stress hits hard, 5 minutes of this breathing can bring your pressure down to a safer range and help prevent panic from making things worse. Now let's put all 3 techniques together in a simple, practical way. Use the first breathing technique for short sessions throughout the day. 2 minutes at a time, several times daily, helps train your nervous system to stay calm. Use resonant breathing for longer sessions, 5 to 10 minutes, once or twice a day, to maintain balance and lower your overall baseline pressure. And reserve alternate nostril breathing for sudden spikes, moments of anxiety, or nighttime pressure surges when you need fast relief. One woman in her 70s combined all 3 techniques consistently. Over several months, her average blood pressure dropped significantly without adding new medications. More importantly, she felt calmer, slept better, and regained confidence in her ability to manage her health. That's the key message here. These techniques work, but only if you use them consistently. Just like medication, breathing practices need repetition to create lasting change. The difference is that breathing has no side effects, no cost, and no limits on when or where you can use it. 10 to 15 minutes a day is enough to make a meaningful difference. Slow, controlled breathing activates your body's natural calming system, relaxes blood vessels, lowers heart rate, reduces stress hormones, and brings blood pressure down from the inside out. With practice, this calm state becomes your new normal, not just something you visit occasionally, but something your body remembers and returns to more easily every day. As you practice these techniques, something important begins to happen. Your nervous system starts resetting itself to a calmer, more balanced state. This isn't just a temporary effect. With consistency, your body learns how to stay relaxed instead of constantly running in stress mode. That's when blood pressure becomes easier to control, not just during spikes, but throughout the day. Here's your simple action plan. First, check your blood pressure and write it down. This is your baseline. Knowing where you're starting gives you clarity and motivation. Second, choose the breathing technique that fits your situation. If you're new to breathing exercises or want something easy and calming, start with resonant breathing. If your pressure feels high right now or anxiety is kicking in, use alternate nostril breathing for faster relief. Third, practice for 5 full minutes right now. Set a timer. Sit comfortably. Give your full attention to your breath. This short window of focus is powerful. Fourth, check your blood pressure again after those 5 minutes and compare it to your baseline. Most people see an immediate drop of 5 to 10 points. That moment is important because it proves this works for your body. Fifth, commit to daily practice. Treat breathing the same way you treat brushing your teeth. Non-negotiable. Morning and evening are ideal. Set reminders on your phone if needed. Sixth, track your average blood pressure weekly instead of obsessing over single readings. What matters most is the trend. As your nervous system calms, those numbers usually start drifting downward. Most people begin noticing meaningful improvements within 2 to 3 weeks. Better readings, fewer spikes, more confidence. Seventh, share your progress with your healthcare provider. Bring your blood pressure log. As control improves, many people are able to adjust treatment plans safely over time. Never stop medications on your own, but breathing techniques often reduce how much support your body needs. A few safety notes. These techniques are gentle and safe for most people. If you ever feel dizzy or lightheaded, slow your breathing and return to normal. Never force the breath. If you have severe lung conditions, get guidance before starting. These methods work alongside medical care, not against it. Very high blood pressure still needs proper treatment, but breathing can significantly reduce how much is required. Here's the bottom line. Your breath is one of the most powerful tools you have for controlling blood pressure. It's free. It's always available, it has no side effects, and it works. People have lowered stress spikes, reduced anxiety-driven readings, avoided emergency visits, and regained control simply by learning how to breathe differently for a few minutes a day. Don't let anyone tell you this is just relaxation. The effects are real, measurable, and repeatable. If this video gave you tools you can use immediately, share it with someone you care about. High blood pressure affects millions, and most people are never taught this. Subscribe to the channel if you want more clear, practical strategies that help you feel better without adding more complexity or fear. Thank you for practicing with me today. You've already taken a powerful step toward better control. I'll see you in the next video, where we continue building simple habits that protect your health and independence.